All right. Hey, everybody. Thanks for tuning in for the final stop of a three-stop virtual tour through Arizona. I want to say that I'm excited that during this tour, we also announced that over 700 seniors from all over the state signed up to join our campaign team. Thank you to everybody who signed up to be part of this mission for Arizona. Last week, I kicked off this virtual tour with a stop in southern Arizona, talking with seniors about the rising cost of prescription drugs. I heard from Henry in Tucson, who talked about the financial pinch he's feeling because the price of prescription medication just keeps going up. And on Tuesday, Gabby joined me for the second stop of this tour in central Arizona, where we heard from John Bauman and seniors about concerns over threats to Social Security and Medicare. Roman from Mesa talked about the red tape that seniors have to navigate while dealing with a health condition. But today we'll be speaking with seniors in Arizona tribal communities who are also feeling concerns about this pandemic and access to health care and their earned benefits. The federal government largely failed Arizona's tribal communities during this pandemic. The United States Senate tried to pass a COVID relief bill, and the first versions of this did not have a dime in it for tribal governments. Governments that were working every day to try to slow the spread of this virus. And then when they did pass funding for tribal governments, the administration held that money up so they could give some for-profit corporations in Alaska some of this money, and it was just wrong. We've seen leaders in Arizona's tribal communities step up to fill the void of leadership created in Washington. Now, this administration is planning to undermine our seniors and tribal communities again with plans to undermine funding for Social Security, risking the benefits that many Arizona seniors rely on to pay for groceries and for medication. Social Security is a promise to American workers that when they get older, these benefits they paid into would be there and enable them to retire with dignity and security. In addition, seniors are wondering if their benefits or prescriptions will be delayed because of cuts to the U.S. Postal Service, especially for those living in rural communities. We cannot allow that. We've got to have the backs of our seniors and our workers in tribal communities. That's why it's important for me to hear directly from folks about the challenges they are facing and the work we still have to do. So I want to kick this off with just some initial introductions. We're going to go around. I'm just going to start with Sheila. If you could just introduce yourself, tell us where you are, and just maybe if you're associated with an organization. And then from there, we'll go over to Linda.
Hi, good afternoon, everyone. My name is Sheila Bedoni, and I am the CW supervisor for Southwest Navajo Nation. And I've been working with the CHOP program for over 11 years now. And I'd just like to say good morning and thank you for allowing me to be part of the panel.
Thank you, Sheila. And Linda, just a little bit about yourself.
Hey, good afternoon, everyone. My name is Linda Andrews. I'm from Gila River Indian Community. I have been retired for about 7 years, and 6 of those years I've worked with our Elder Concerns Group, which is an organization that was meeting on a monthly basis to hear the concerns of elders throughout Gila River, and have been able to try to assist them. And right now, this is my 2nd year as chairman for that organization.
Well, thank you, Linda. And finally, Rosemary.
My name's Rosemary Lopez, and I'm from Tana Autumn. I live here in Sells, and I just recently retired about July 2nd of this year. So I'm very new in terms of, I had a lot of questions on Social Security, but because of this COVID, you know, all our administrative offices were closed, and any information that you needed, you had to get on the Social Security links. And I'm not particularly an expert in maneuvering the computers and all. So I had a hard time getting information, but eventually I did. And I sent my application for Medicare Part B because I had, because of my work all these years, I was covered by my insurance. But now that I'm no longer insured, you know, I have to cover request for the Medicare B, and I haven't heard any information from them as yet. As I understand, it takes a while and probably take longer now with this COVID. And all the offices are closed with Social Security. You can't call, you can only email um, information to them. So it's been difficult for me as a new retiree, and I'm learning.
Well,
So
thank you, Rosemary. We're going to come back to you in a couple minutes here. I just want to start with Sheila for a second. And actually, for all of you, thank you for being here. But Sheila, can you tell us a little bit about the region that your team works in, and what are the top concerns that you hear from seniors as the supervisor for the Community Health Worker Program?
The region that I provide services to is the Southwest region of the Navajo Nation. So that would be that there's like little communities. So I would start with a community called Jegito, and then Indian Wells, and then also Whitecomb, Delcon, Bird Springs, Loop, Talani Lake, and also Keystone. So those, we call it, with the Navajo Nation, they go by districts. So with the Southwest region, that would be District 5 and District 7. So we cover a mass portion of the Southwest Navajo Nation. The services that we do provide as community health workers, pre-COVID, we would go out into the communities every day and check on the high-risk elders. And what we mean by high-risk elders are the elders that live alone, the elders that have multiple chronic medical conditions, elders that don't have transportation, that do need help as far as scheduling medications and stuff like that. So those are some of the things that we help the elders with, calling in refills on their medications, and just outreach for them, and also obtaining resources, reaching out to different programs that are out there, like maybe an elder needs help, so we help them get in contact with Altex, Arizona Long-Term Care. We help them fill out applications, or if they need like a handicap ramp, so we, fill out paperwork for whatever resource or program that is out there. So that's how we usually go out on a daily basis and check on the elders and help them. And we check vitals. A lot of case management is what we do. And since COVID started, we've been pretty much out, like frontline. We've been delivering to food boxes. We've been delivering essential items, care packages, water, whatever the needs are. And then we also were working with the closest hospital within our service unit is Winslow Indian Healthcare. So we partner with Winslow Indian Healthcare to go out and distribute food boxes and all the essential items. The same thing with the Navajo Nation Health Command Operations Center. So the individuals that are COVID positive, they would be calling the Health Command Center. And then from there, the Health Command Center would reach out to us, and then we would be delivering food boxes. So that's what we were doing majority of the past 6 months. So we were pretty much boots on the ground, frontline workers, and now it's slowly, I guess, tapering down. But pre-COVID and then since COVID started, I think that the most important thing that the elders need is resources, like as far as like where do they need to go, who do they need to contact, and stuff like that, as far as food, water, because a lot of people, they don't have running water. We did get some 17 pallets of water from Navajo County. So we distribute those out to the 8 communities that we provide services to in District 5 and District 7. We just got done with that. So certain communities, they reach out to like the grassroots individuals who receive donations. So we also help them as well, help the chapter, wherever help is needed.
Mhm.
So as
Yep.
far as resources, as far as water and stuff like that, medication, and one of the things now that I'm hearing a lot is, since COVID is tapering down, a lot of them are like afraid to go into the clinic, go back like on campus to the clinic and go back into the hospital because they're afraid that, they could catch the virus. But, we have to educate them on that it's okay to do that, make sure you wear your mask, make sure, you have hand sanitizer with you. And then we have to explain to them the process. When they get there, they get their temperature taken and they can go. So those are some of the things, that we've encountered. So, but other than that, a lot of the things that I think the number one thing that is needed is nursing homes.
Mhm.
Nursing
Sheila,
homes.
could you explain for a second, because you mentioned the Arizona long-term care system, and there is the elderly and physical disability program as part of that. What benefits are available for seniors through the elderly and physical disability program?
Through the Altex program, they do get home care providers. That's the number one thing that they receive. And then the home care providers are in the home depending on the number of hours that's given to the home care provider. And then the home care provider takes care of the medication refills and make sure that their appointments are scheduled. And then Altex also provides transportation to their appointments. And the number one thing that the elders, they need like eye exams and denture appointments, but Altex doesn't cover those services. So they have to find transportation. And because the elders who qualify for Altex, they're pretty much at nursing home level care. So it's like takes a lot of time to get the elder ready, get them into a vehicle, then take them to the clinic. And especially with COVID right now, it's kind of hard to do that.
Yeah.
So that's one of the other things. And so a lot of the elders will be calling us, can you transport us to our eye appointment or to the dental, stuff like that. So those are some of the things that, and then they also provide like handicap ramps, and then also the shower safety ramps that the patient would need. I know there's some elders that I've seen where their Altex went in and redid their door so the wheelchair can go into the bathroom or through the door to their bedroom. So, and then high-rise toilet seats, bedside commodes, and those are some of the things that Altex offers.
Well, thank you, Sheila. I think May just joined us on the phone. So May,
I am right here.
hey, it's good to be with you. So it's myself, Linda, Sheila, Rosemary. We're talking about some of the issues that seniors are facing. Can you just first introduce yourself, and then I got a couple questions for you.
Okay. My name is May Peskai, and I live up in northern Arizona, a place called Cameron, and I lived on the reservation all my life, and so I'm of the Tangleville clan, born for the Deerwater clan, and my paternal grandfather is the Rock Gap, and maternal is the Salt clan. So this is how we introduce ourselves on the Navajo.
Well, thank you, May, and I really appreciate the support of your daughter, Jamasita, and her service to the state of Arizona in the state Senate. And I hear you know everybody in the Navajo community. So can you tell us a little bit about how COVID is impacting seniors on the Navajo Nation?
Well, at first, it was just like Trump said, it was a hoax, and then we got to realize that it was really here and something that none of us in our lifetime have dealt with it, anything like this, because, like 100 years ago when the that measles or whatever virus that came, we didn't experience it because we were so isolated. And now that it's here, it's hard to understand, you know, especially with the elderlies. And, you know, if you don't see it, you don't believe in it. But if you see it, then it becomes a reality. So these are some of the things that but we really had to stress and teach our elderlies about the what it does and how it just, if you don't see it, if you don't, you know, you just contract it. So we come to realize that it's here. Well, you know, like I'm going to go into, you know, dealing with a lot of up here. We are the largest tribe, the Navajo people, but we are so far behind infrastructure, the water. Right now, we're having to deal with a severe drought, and you know, we haven't had any rain. The monsoon hasn't produced anything, so you know, being clean and then wearing the mask. That's all we've been stressing to the elderly.
Yeah, May, that drought, you know, is extended, you know, throughout the entire state. We got barely any water this monsoon season here so far in Tucson and southern Arizona. And it does highlight the water infrastructure issues we have across the state, and especially on the Navajo Nation, the lack of running water. I imagine that's been really tough on the elder population, probably particularly difficult. Can you share anything about that?
Share about what?
Well, about the lack of running water on the Navajo Nation and how it is affecting seniors.
We're so widespread. You know, a lot of the elderlies, they live way out, you know, not near the towns, and that's how they choose to live, because we believe, the Navajo people, the elderly, still believe that if you move into a town, and then the federal government comes along and claims that you're not utilizing your land, so they take it away. So they choose to live without running electricity. It's still on today. So it impacted our elderly. Usually about this time of the year during the monsoon, you know, we have water, and the elderly would put barrels outside or whatever they can to get water, and they reboil it and they know how to use it. But right now it's not, we're not doing that, you know, how to make rainwater, be able to drink it, or livestock can drink it. But today it's different. So that really, I think, you know, with no running water, when this virus came, it just like boom, you know, and the kids would come home back from Phoenix area or the border towns where they work, and they go home with come home with it, or they carry it outside the reservation. So this is how it affected most of us elderlies. But I don't, you know, I live in a community that has running water and electricity.
This pandemic has highlighted a lot of inequities in our healthcare system, but also services and infrastructure, like the ability to deliver water. And clearly, we need a large federal infrastructure program, which includes upgrading infrastructure in tribal communities. Let me go back to Rosemary.
Yes.
Rosemary, you talked a little bit about your challenges trying to get signed up for Social Security and Medicare benefits, I believe both. Were you successful in getting through that red tape and that process? And are you receiving those benefits now?
I'm receiving my Social Security. I'm 79 years old, so I've been receiving my Social Security, but it was getting on Medicare Part B
Okay.
and insurance coverage. And I understand I can't apply for any plan until I have my Medicare Part B. So that's what I'm waiting for. So I'm hoping that they'll eventually see my letter and respond. It's been about a month, but I understand that it takes a while, and then with this COVID, it's probably going to take longer. So that's what I'm waiting for. That's what I'm experiencing right now, personally. And I wonder uh, how our other elders that have uh, somehow being assisted by other programs. I know we have Alltex here, and I know that they provide a lot of providers for individuals to keep them out of nursing homes.
Mhm.
And the elders themselves want to stay home rather than going into a nursing home. So I'm just waiting.
There are clearly other options that can be, it's always best to keep somebody in their home, and that's good for, often very good for the senior as well. There have been some recommendations out there to provide tax credits for informal caregivers. That would be helpful. And there are certainly other things. We've got to make sure that access continues to get its, not be defunded or underfunded, because access provides not only healthcare for 400,000 additional Arizonans after the passage of the Affordable Care Act, but at the same time, it funds out what you said was Altex, the
Right.
Arizona Long-Term Care System, and the Elderly and Physical Disability Program. So cuts to access cuts those programs and will really hurt seniors. And Linda, we've been waiting a while. I apologize for taking so much time to get to you, but as part of the Elders Concern Group for the Gila River Indian community, could you share some of the issues that your elders are facing?
I think the biggest issue that we faced in the last couple of years before COVID hit was the grandparents caring for grandchildren. And that takes a whole different way of looking at Alltex assistance for those that may need it, for Social Security, because some of the elders, that's their support, for the children also. So that's going to make a big impact if Social Security goes away. The caregiver program is also an area that was assisting and trying to find ways of giving one, respite care to the grandparents, respite care for the kids also, in working together in trying to make sure that home life was good for them.
Mm-hmm.
We were getting a lot of information together before COVID hit from all the programs within Gila River that were supporting grandparents raising grandkids. But after COVID hit, then now we see that the caregiver program, as Sheila was talking to, we also need that a lot, because there is a long waiting list for caregivers. And then now we see that COVID is going to make a bigger impact in that because of the after effects of COVID on individuals. We see that. And so then there may be those places where grandparents can no longer raise their grandchildren. And then we're going to have a whole other issue of trying to find a place for the children to go. Not to mention the grandparents having to understand access maze to go through, especially
Yeah.
when they have kids with special needs.
Mm-hmm.
There are different insurances that Access has to help but the grandparents have to know which ones are the right programs to give them the testing that they need to understand what their disabilities are.
Yeah.
So, all of that came together in speaking with the grandparents or caregivers.
I understand their concerns about Social Security benefits and Medicare benefits being at risk. It's been talked about certainly before and after a passage of a $1.9 trillion tax break. There were some discussions about that. If given the opportunity to serve in the United States Senate, I will be fighting for Social Security and Medicare to make sure that these benefits are not eliminated or reduced. These are earned benefits that seniors rely on across our country, and they shouldn't be messed with. I'll be there to fight for that. I'm interested in Linda for a second. So, most of the seniors that you deal with, how do they get their prescription medication? Does it come through the mail, or are they often having to drive down to a pharmacy or store to get it?
Yeah, most of them are able to go to the pharmacy at Gila River Healthcare to obtain there were 3 facilities on Gila River. There are only 2 currently open that elders can go and pick up their medication, or they can have public health nursing go and pick it up for those that may be homebound.
Mm-hmm.
So that would be, but then again, a lot of them, like is being said, are afraid to go into the hospital facilities because they think that they're going to contract COVID there.
Mm-hmm.
We do a lot of testing. We have been testing all of our all of our employees, all of our members in the community on maybe a monthly basis to see if they have COVID and, continue to monitor that. But now, like everything else in the United States that you hear about, the testing numbers have come down. But still, there is that need to find out. And some of them are saying, well, if I get it, I get it. But, there's a way to prevent it. So maybe we shouldn't think that way. But that's kind of some of the mindset that has been expressed in some elders.
Yeah, I think Public Health 101 says we need to test a lot of people, do it frequently, get the results, trace their contacts, and make sure those folks can't spread it to somebody else. That's clear. It's a matter of doing it. We've wasted a lot of time. We shut down our economy, and then we didn't come up with a plan to do this at a large scale. And I'm still waiting to see that plan from the federal government. Speaking of the federal government, Sheila, can you briefly, because we only have a couple more minutes, you briefly just outline some of the help you would like to see or solutions you'd like to see from Washington in terms of better support for seniors in tribal communities?
I think that from Washington, the number one thing that we need help with is more funding. Like the past 2 years, I know the CHR Community Health Representative Program and Health Education Program, the budgets were zeroed out. But thankfully, we did receive our budgets, and also the same thing with the elder programs where the senior centers, they do receive their funding. There's a lot of there's a lot of things, a lot of services that were eliminated due to limited funding. And like I mentioned earlier, I would say that there should be some type of funding for nursing home, and one of the other things that is very critical is transportation to their appointments. That's the number one thing that I think that there's barriers to, because a lot of the elders, they have to qualify for access in order for them to receive transportation. But the ones that have retirement benefits, they're told that they're over the income limit. But they do have the income, but a majority of them, they can't drive themselves to the clinic. So they need somebody to transport them. So those are some of the things, I think some of the things that, I would like to mention. And then also if you don't mind me going back to Ms. Peshakai's response as far as the drought, like what are some of the things that we see on the Navajo Nation as far as drought? The number one thing is everybody is looking for water on the reservation. With the windmills, the windmills are broken. They all need to be repaired. There's a lot of people that are in line at NTUA, Navajo Tribal Utility Authority, but they have to pay, and some of them are driving like an hour drive away from their home to get water. And this is water not only for the household, but also for their livestock as well. And so those are some of the things that is critically needed. And because of the drought, the dirt roads, they're forming potholes. They're forming potholes, and the roads are really, really bad, washboard everywhere. Those are some of the things that, you know, I've seen as far as the drought is concerned. So even within that, the Navajo Department of Transportation, you know, I'm pretty sure they get funding, but you know, there's probably more people that need to be hired to be qualified to fix the roads and stuff like that.
Yeah,
So those are just some of the things right off the top of my head that I can think of.
Yeah, last year I had the opportunity to visit the Navajo Nation, I think 3 different occasions, and I
Mhm.
got to spend some time on the roads and visit some chapter house and talk about some of these issues. And you're
Mhm.
right, I mean, water infrastructure is incredibly critical,
Mhm.
and getting the roads repaired, it's a challenging thing to do, but it affects so many other things. It's not just about driving your car down a road that's in a pothole.
Yeah.
It's about
Throw something in.
yes, May.
Yeah. Well, what I wanted to say was that, you know, us Navajos, we're the largest tribe, okay? And in order for us to get these much needed infrastructures or programs that are on the reservation, first of all, we need everybody counted in our census count. And because if we don't get the proper census count, we only what happens with you know, the lack of the count that goes to the lack of funding for our vast reservation. So that's what I just wanted to say.
It's critical that those census forms get turned in by everybody so everybody gets counted. That affects not only
Yes.
infrastructure, it affects so many other things in a community, including representation,
Yes.
which is important.
Yes.
So I want to thank all of you. It was very important to me that as part of this virtual tour that I've been doing on the campaign trail here, that we heard from seniors in tribal communities about the challenges that they're facing, because those challenges, they might be, and as we heard, they're different from some of the challenges that seniors are facing in places like Phoenix and Yuma and Tucson. So these conversations with seniors across the state remind me of just how urgent it is to protect the benefits that our seniors rely on to pay for things like groceries and medication. It also reminds me why I'm running for the US Senate in the first place. And our seniors have worked hard all their
Yes.
lives. They can use these benefits they've earned to enjoy a comfortable retirement. And it's time that Washington honored its promise to ensure that seniors can retire with dignity and security. And it's far beyond time that we take serious action to lower the cost of prescription drugs, especially for seniors. So thank you again, Sheila, May, Rosemary, and Linda. Thanks for taking the time to do this.
Can I
Thank-
just say something before you close
Yes.
off?
Yes.
You know,
Thank you.
I've been, this is Rosemary Lopez, and I just want to say that I'm really happy that you were able to make contact with the tribes. But I just want to say that I'm hoping that, you know, I've been Democratic all my life, and I voted with every, so I'm hoping that everybody's thinking about helping vote Democratic so that we can get Martha McSally out. You know, she calls on their telephone, pick up the phone, and she says, "This is Martha McSally. I'm having a town hall per phone, and if you want to stay, you know, participate, you stay on." And so we usually hang out hang up our phone. So I'm always concerned about what's happening from Mark Kelly's side. What's going on? Finally, yesterday I got a card from the Democratic Party saying McSally's, which I agree, hasn't done this, and that. So it's fine to talk about all our needs, but we need to vote and we need to get all our relatives to vote. So to me, that's really important right now. Thank you.
Rosemary, our democracy works best when a lot of people vote.
Yes, and I'm concerned about the Social Security. I understand that Trump did that defer, or what is it? What's called, and eventually that's going to do away with the Social Security if Congress doesn't vote to in the next year overdo that
He
law
has,
that they put in place.
he has suggested, and he's putting in place some steps to cut payroll taxes, at least for the rest of this
Yes.
year for federal government employees. But they've suggested that payroll taxes be either cut or eliminated. That is the funding source for Social Security.
Yes.
So May, I'm going to give you the
Yeah.
final.
Yeah.
So
Hello?
yes, May.
Oh, yeah. Well, I'm sorry that I didn't get to sit on the whole meeting. I had the hardest time with my phone, and I somehow attempt the last part, and I got in. So yes, I support you, and I am a permanent volunteer for
thank
the
you.
Democratic Party, and I've been a Democrat all my life. I worked for Elizabeth Warren, and I traveled through the whole Navajo Nation, and I worked with everybody that was a Democrat. So that's how I give my support to the Democrat. If everybody around here in Cameron, I run into them and I tell them, vote this way, vote that way. And some people do come out and ask me, who do you want me to vote for? I said, I know it's your right, and I shouldn't be telling you what to do, but it would make sense for you to go this way. And so I think I have a lot of the respect of the people in my area, and of course the reservation. And our world is getting smaller and smaller with all these technologies that we have, so we can all reach out and do what we can to beat this man, up in Washington, D.C., and for the state of Arizona, everybody to vote blue. So that's my goal. And by the way, I'll be 72 tomorrow. So,
Well, May,
yeah.
happy birthday.
Yes.
We wish you
Very
get
young.
Thank you very
birthday.
much. Thank you,
Yeah.
all of you. Thank you.
Rosemary, Linda, May, thank you. Really appreciate you all joining me.
Thank you.
And we're going to work hard and fight in Washington for successful in this election. So everybody, please stay safe and
Yes.
see you all soon in person.
Yes.
Thank you.
Yes.
Thank you.
Thank you.